All right. Hello and welcome to another Move with the Doc. I'm Dr. Roopa Shah, a board certified family physician and health and wellness coach. And as always, during these sessions, feel free to stretch, move, just anything to get a little bit of movement into your day. Today, we're going to talk about kind of an interesting topic, oral health. I took a little liberty with this topic, so it's not just going to be about the mouth, but things related to the mouth and oral health. So, diseases basically of the mouth and the jaw can have a huge impact on our health, and we sort of forget about this area, right? But we're going to shed some light on it today. So, our mouths and oral cavities collect all sorts of bacteria, viruses, fungi, and many of these make up our normal flora in our mouth, of course. There's also what we refer to as an oral microbiome, just so similar to the gut microbiome, and of course they are connected. But the oral microbiome is also starting to get a lot more attention lately. And again, the oral microbiome basically just refers to all those bacteria, viruses, fungi, everything that makes up that oral flora in our mouth. And this is actually probably the second most important biome of the body after the gut microbiome, which we have spoken about in the past. But in addition to oral disease, oral bacteria have recently been linked to systemic disease ranging from diabetes to coronary heart disease and even to bacterial endocarditis. So, just like the systemic effects associated with the skin microbiome and the gut microbiome, there is also an immune component driving systemic inflammation in response to altered oral microbiome. So this kind of grouping of bacteria and fungi and viruses in our mouth can have important health consequences for the rest of our body. It can really have these far-reaching effects, and it's sort of interesting to think about. Just like what happens in here can have an effect maybe on your heart or your joints, your immune system, all of that. The diet is, as in other conditions, is hugely impactful when we're talking about oral health. Sugary foods, sugary drinks, all of those can lead to effects in the oral microbiome, and of course lead to cavities and periodontal disease. Another factor in poor dental health is acid reflux. So I wanted to bring this up. Acid reflux, also known as heartburn, the acid from our stomachs, comes up into the mouth and can actually erode that enamel in our mouth and cause dental decay and cavities. So if you go to your dentist and suddenly they may be noticing, oh, you've got a lot more cavities than you've had in the past, you may need to consider speaking to your physician about what we call asymptomatic heartburn or silent reflux. Now, dentists are very keenly aware of this as well, so they may specifically tell you, please go talk to your physician about silent reflux if you're not already taking something for heartburn or reflux. So what happens basically is when you sleep, this acid, when you lay flat, the acid from your stomach is refluxing all the way up and into your mouth. And again, then eroding that enamel in your mouth. So you may not really be aware that you're having this heartburn. So you may not get that classic burning in your chest. But what you may notice is that when you wake up in the morning, you have this chronic sore throat, a dry mouth. You may have a sour taste in your in your mouth. Or when you go to brush your teeth, you may feel nauseous or like you might want to gag. Some people do actually even vomit in the morning. So all of those can be symptoms, signs and symptoms of silent reflux, or what we call silent heartburn. So if you're noticing that, talk to your physician, and you may benefit from treatment for that as well. Another disease that I just wanted to briefly touch on, somewhat more rare, but there is a condition that presents predominantly with oral symptoms, and that's Sjogren's syndrome. Sjogren's is an autoimmune disease that can present with both dry eyes and a dry mouth. You can feel like your mouth is full of cotton. It can be hard to swallow. You may feel thirsty. But in addition, people may experience joint pain, joint swelling, joint stiffness, and even skin rashes and fatigue. So again, it's an autoimmune disease, but one of the predominant symptoms is the dry mouth and the dry eyes. Usually both of those things will occur. There is blood testing for this condition. So if you're experiencing some of these symptoms I talked about, then it would be worth talking to your physician to get some additional testing for this autoimmune disease. Another disease, of course, I can present with dry mouth is type 2 diabetes. And this can really be one of the presenting symptoms of type 2 diabetes. And sometimes just the very first symptom that people will notice. This is caused because you get decreased saliva due to the very high circulating blood sugars. Other symptoms people may notice is a dry tongue, cracked, dry, chapped lips, even sores in your mouth, or even dental infections or pain in the mouth sometimes too. So again, if you're noticing symptoms that are really affecting that dry oral mucosa, then speak to your physician, because there's a whole lot of testing that could shed some light on what could be going on there. So let's shift gears a little bit to temporal mandibular joint disorder, or TMJ. So again, temporal mandibular joint. This is a sliding hinge right here. It's connecting your jawbone to your skull, and you have one on each side of your jaw. People are familiar with some of the symptoms, but this can really cause a lot of pain in your jaw, just at rest, or specifically with chewing or opening your jaw, especially if you open really wide. Like if you're trying to get something really like a large hamburger or something in your mouth, you may really notice at the extremes of opening that hinge joint that you're having some pain, or clicking even can be a possibility. So a lot of times this can be from genetics. You can even get arthritis, believe it or not, in this joint, or injury. Like if you've been chewing on a lot of hard, crunchy things lately, that can even be a cause of injury. But another and a more common cause really is constant clenching or grinding when you sleep, which can be due to underlying stress. So if you're feeling like you have some symptoms that are, in this region, just right in front of your ears, you're noticing that clicking, pain with opening, then definitely it's a good idea to talk to your dentist first, because they truly see this quite often. In fact, your general dentist, but there are also specific TMJ specialists for this condition. Your dentist may be able to help initially by prescribing a type of night splint or a night guard. I actually have one. I didn't realize I was grinding my teeth, but I was getting a lot of headaches and then just noticing some pain. And it really can help to kind of cut down on the amount of grinding and clenching you do at night. But another reason I bring this up too is because I know we're talking about oral health, but the underlying cause can really be a lot of stress and anxiety. So talking to your primary care physician again, if you're experiencing this, that can be another way to treat what is kind of the sequelae of that anxiety, which is the grinding and the clenching. Another treatment that's become widely popular now for a lot of clenching and grinding is Botox injections. So what the neurologist can do, or some dentists are actually trained in this, and so they will inject into this masseter muscle some units of Botox to help relax that treatment. Now, of course, or relax that muscle, but of course, that treatment has to be done every 3 months in order to continue to prevent the grinding and the pain. But just another option for people with really severe grinding and clenching. Another condition that I felt was a good one to bring up as we're talking about oral health is sleep apnea. So it's important to distinguish. There's actually two different variations of sleep apnea. One is what we call central sleep apnea, and the other is the one we're more commonly familiar with, which is obstructive sleep apnea. Central sleep apnea, again, it's less common, but I just wanted to mention it. It's a form of sleep apnea when your brain is actually failing to send signals to your breathing muscles. So this means that you might not be making an effort to breathe for a short period of time, and you might awaken with shortness of breath or difficult time getting to sleep or staying asleep. So that's a sort of different form of sleep apnea. It's called central sleep apnea. But what I wanted to talk about really is obstructive sleep apnea. This is the more common form. And this happens when the muscles in the back of your throat really relax. Those muscles are really important because they support the soft palate, your uvula, the tonsils, the sidewalls of your throat, your tongue. And when those muscles relax too much, your airway narrows and can close as you breathe in. So, as you would imagine, this is quite problematic. You don't get enough air in, which can lower your blood oxygen level. And when your brain senses this, that you can't breathe, you briefly wake up in the middle of the night so that you can reopen your airway. The awakening at night is so brief that most people aren't really even aware of it. But your sleep partner may notice that you are snorting, you're choking, you're gasping, and this pattern can really repeat anywhere from 5 to 30 times overnight. And it can really make it hard for people to get that deep, restful sleep that they need to feel rejuvenated the next day. So that's why we're really trying to promote awareness of obstructive sleep apnea, early detection, and treatment for people. So, symptoms of sleep apnea, obstructive sleep apnea, or even central sleep apnea is that you're going to wake up a lot of times with this morning headache. You're going to feel sleepy during the day, maybe wanting to take a nap, fatigue, irritability, difficulty paying attention. These are all symptoms of just not getting that restful night's sleep. Some of the risk factors, let's go over those that can lead to sleep apnea. Well, first of all, obesity. So obesity, we know, greatly increases the risk of sleep apnea. The fat really deposits around your upper airway and your neck, which can then obstruct your breathing. And again, people with larger neck circumferences are at increased risk for developing sleep apnea and having those narrower airways. Being male, men unfortunately are about 2 to 3 times more likely to have sleep apnea than women, but women's risk does increase if they're overweight or have gained significant weight, or even if they've gone through menopause. This seems to be another risk factor for developing OSA or obstructive sleep apnea. Just being older is a risk factor for developing OSA, and even family history and your genetics can play a role in this. Let's not forget about alcohol, sedatives, and sleep tranquilizers. All of these substances, anything that's going to overly relax these muscles in your neck as you sleep is going to contribute to potentially developing OSA. Medical conditions also can predispose. Things like congestive heart failure, high blood pressure, and even type 2 diabetes increase your risk of obstructive sleep apnea, but also polycystic ovarian syndrome, certain hormonal conditions, having had a prior stroke, these can also increase your risk for sleep apnea. So if you think you're having it, definitely talk to your physician, because what we're finding is that sleep apnea is more than just the snoring, more than just disturbing your bed partner and just feeling tired. There's really serious medical complications that we know that can occur from having chronic obstructive sleep apnea. We know it can lead to high blood pressure and different heart problems. So sudden drops in your blood oxygen level while you sleep that occur during OSA can increase your blood pressure over time. So if you're noticing that your blood pressure has increased, or I will even say, if your physician is noticing that, oh, we're having a really hard time controlling your hypertension with maybe 1 blood pressure med or 2, or we're needing 3, we need to start thinking that there could be sleep apnea. Sleep apnea can also increase your risk for a heart attack, stroke, and arrhythmias. Arrhythmias are basically irregular heartbeats, things like atrial fibrillation. So if you have heart disease and multiple episodes of low oxygen while you sleep, this can even lead to sudden death from an irregular heartbeat. So again, this is why we're really sort of zoning in on sleep apnea and asking people, hey, if you're tired, if you're feeling sleepy during the day, let's get you tested for sleep apnea. Sleep apnea can even increase your risk for type 2 diabetes and developing insulin resistance and metabolic syndrome. Remember, metabolic syndrome is basically this cluster of diagnoses, which include high blood pressure, high cholesterol, an increased waist circumference, and increased blood sugar. Sleep apnea can also occur if you're taking certain medications, and of course, with general anesthesia. So, if you're going to be having surgery or major surgery that's going to have general anesthesia, when they lay you flat on your back, um, sometimes this is when people find out that they have actually a very moderate or severe form of sleep apnea. And your anesthesiologist is not going to want to know that when you're on the table. So, again, a really good idea if you're having major surgery and when you go in for what we call that preoperative clearance exam, to talk to your physician if you think, like, hey, I might have sleep apnea and I'm not currently being treated, because it can really increase complications from any type of major surgery you may need to have. So, lastly, today, I just wanted to touch kind of on this interesting, popular kind of wellness trend that I came across that's been seen on kind of social media, but it's called mouth taping. Some of you may have heard about it. It's called mouth taping, or kind of the more technical jargon is adhesive mouthpiece therapy. So basically, mouth taping, you tape your mouth at night, and it basically forces you to breathe just through your nose. And when you breathe through your nose really, with all the hairs and the cilia in there, really filters the allergens and debris from the air before it reaches your lungs. Also, it can help control the temperature of the air that you breathe, and it keeps the air more humid because you're breathing through your nose instead of through your mouth all night. So some of the theories, and I'm going to say theories, behind mouth taping is that by avoiding breathing through your mouth, you might avoid bad breath, dry mouth, poor oral health, and possibly even sleep apnea. So that's kind of why it's being looked at. But I'm going to give this a thumbs down right now for trying this, because there just isn't enough scientific research as of yet to say if any of these claims are true and if it really has any health benefits for people. So we need more research to kind of look into how often somebody should do this, what kind of taping is best, how long you need to do this. There was one very small study. I don't think it was a great study, but they found that people with really mild sleep apnea who often did that mouth breathing did have less snoring when they did mouth taping, because it, again, just forces you to breathe through your nose. When they looked at mouth taping for asthma, because that's another thing that's being looked at, is that they really didn't find that there was any improvement in the asthmatic symptoms. So if you're thinking about trying it, I, again, would probably give this a thumbs down. And until we know more and there's really some more scientific evidence, probably not something great to try. So that's what I have today for you. I hope you learned just a little bit something on some conditions that can affect the mouth and the oral microbiome. If you have any questions, feel free to reach out and have a great rest of your day.